Happy Friday. So I have really been wrestling with whether or not I wanted to come on here and share what I'm going to talk about today, but I can no longer be silent about this. And I mean, it's been keeping me awake at night. Like I have to share about this. So you probably saw my post the other day that was the SOS Just Asking campaign. And you might be wondering why I am posting about that. Those of you who know me know why I'm posting about that. But those of you who don't know me personally, that I have not been open with about this previously, I just want to give a voice to some things. So I am a board-certified pediatric nurse. I've spent over a decade working with pediatric populations and their families in hospital, outside of the hospital, in community settings. Now as a health coach, working with parents individually to address health concerns. And I am appalled at some of the bills that are coming down across the United States that they tried to pass in Washington this last year, and that they are passing in California. And I'm going to share with you why it matters, because you might be thinking like, oh, she doesn't live in California, but you know what? It sets a precedent, and that's what the issue is. So if you have not been following along, SB 276 and SB 277 originally started to remove religious exemptions. And the reason that they did this was because they were having all of these outbreaks of communicable diseases in spite of the fact that they had almost 100% vaccination rate. So what that means to me, this is my medical science background speaking. Viruses do what viruses do. And that means that when they are by their nature going to find a path to replicate. So regardless of the fact that California, in different areas of California, there have still been outbreaks of pertussis, which, by the way, if you go look at the failure rate for pertussis on the CDC's website, I don't have the graphic with me, but I'd be happy to show you if you have questions. Pertussis is one of the least effective vaccines out there. So I'm just putting that out there. Even in these communities where they have an almost 100% vaccination rate, they're still seeing outbreaks of pertussis, measles, etc. So then there was this huge push to remove religious exemptions, because their belief was that it's these kids, that are getting religious exemptions that are the cause of the outbreaks, even though if you go through the HHS and you look at who was coming down with these illnesses, it was not the unvaccinated. It was actually children who were vaccinated. Regardless, I'm actually not anti-vaccine, okay? I am pro-choice. I am pro-informed consent. And the reason that I feel like an anger rising up in me that I don't know that I've ever experienced before. The reason that this is offensive to me as a medical professional, and I hope that medical professionals that are listening and are watching this will hear me, that this goes against everything that we agree to as a medical professional. The right to informed consent. So what is informed consent? It means that if I have a patient that comes in for ear tubes, and the surgeon and the anesthesiologist have to come into that room and they say every possible outcome, good and bad, that can come from this procedure. And you sit in there and you listen to them for 30 minutes, list off everything that could possibly go right and everything that could possibly go wrong with this procedure. And the procedure does not happen unless both parties sign that consent form. So that is true informed consent. True informed consent is knowing the risks and the benefits. When you go to your physician and you say, I want to know what the risks are to this vaccine, they're going to tell you there are none. And The reason that's not true is because every medication has side effects. There is the potential for side effects for any medication. So just putting that out there as a medical professional, when you flip open the nursing drug guide, it's nursing implications, side effects, contraindications. So that being said, your physician, when you have a good working relationship, should be going over with you, Andrea, I'm going to prescribe to you this heart medication that's to help stabilize your blood pressure. But just so you know, I want you to let me know if you experience any of these side effects. Some of them are harmless side effects. Some of them are not harmless side effects. That is true informed consent. So what this bill is seeking to do is not just remove exemptions. And the legislatures will say, oh, but you can still get medical exemptions. You cannot get medical exemptions. You will not be allowed to get a medical exemption unless your child has had an anaphylactic reaction to that particular vaccine. So my question is, if the schedule says you need to get 6 vaccinations in one appointment, how will you know which one you're reacting to? Number one, that's a concern to me. Number two is, how can you say that they let's say my child has an anaphylactic reaction to DTaP and we're spacing out our vaccinations, and I'm like, gosh, that was really scary, having to go to the emergency room and be given epinephrine and watching my child not be able to breathe. Okay, that's pretty scary. Then there's like, well, we can't write you an exemption to the MMR because they reacted to DTaP, not MMR. However, the majority of the ingredients, the adjuvants, the additives, not just the virus, within those immunizations are the same. So we don't know if my child reacted to DTaP, the diphtheria, tetanus, and pertussis viruses, the antigens, or if they reacted to the actual adjuvants like the aluminum and polysorbate and all those other things that are in there. So what this law is seeking to do is to not just remove for your child if they have previously had a really bad experience with vaccines, or let's say like in our case, our oldest has a vaccine injury. If you choose not to vaccinate your younger child because you had a really bad experience and you've spent thousands and thousands and thousands and thousands of dollars out of pocket to get your child well, you don't want to go through that experience again with your other child. They will not allow that. And they're going to be reporting physicians who give more than 5 exemptions in, I believe it's a year period of time. But why this is concerning is that it sets a precedent of stripping us of our medical freedoms. So if you look at the Nurse Code of Ethics, which is similar to the Physician's Code of Ethics, and the Hippocratic Oath, which is what we align ourselves with when we sign up to be nurses, it is that a patient has a right at any time to refuse a medical treatment, okay? So what the state of California is doing is saying, sure, you can refuse, but you're no longer allowed in public schools. You're no longer allowed to even, and the state of Oregon was working on passing this last year, you're not even allowed to create a co-op if you choose to not vaccinate your child. You are no longer allowed to create communities where your child can learn in a stimulating environment. So I just want to speak to something as a special needs parent. My daughter has a severe autoimmune condition that we have spent close to $10,000 in the last year working on. The fact that she is able to go to school is a miracle. The fact that she's able to sit in a classroom and learn in spite of this autoimmune condition that affects her brain is a miracle. It's also a miracle because it means that I'm getting the help that I need for her to get better, but also so that I can have a break. The thing with, if you have a child who has special needs, let's say they were vaccine injured and the physician says, you know what, I noticed a distinct regression in your child. I am not comfortable administering any vaccines, and you are not allowed to, under this law, go to, put essentially because of this law, your children will be denied services, which really puts special needs parents in a really crappy position because, number one, we're already not able to work as much as somebody maybe who does not have those issues, because we are the primary care provider. We're the one who has to drive them to their appointments. We're the one taking care of all their medications, et cetera, et cetera, et cetera. Our pay and our ability to work and provide for ourselves is already limited. And then you take away their right to an education and their right to services that come through the public school system that you're still paying your tax dollars on, by the way. So this is a problem. One, because it violates medical consent, and it puts that consent in the hands of a bureaucratic party to make a decision that a physician is only really allowed to make. What I mean by that is they have taken that conversation out of the patient-physician relationship and put it in a government entity who's going to look at your child's paperwork, not have an understanding of their labs, not have an understanding of their medical condition, and decide whether or not you will be allowed an exemption. That makes no sense. Patients have a right to choose. You as a mother have a right to advocate for your child without being kicked out of your physician's office. We were told to never come back to our pediatrician's office because I asked if we could delay vaccinations. Like, how is that in a patient's best interest? So I'm probably going to lose some followers, and that's okay. Because you know what? This is really important. And it's important that you understand the laws of your state. It's important that you understand your voice. It's important that you understand the rights that you have as a parent. There's a lot of really good information out there. So I'm going to tag some of my favorite accounts that have tons of information on this. And again, I am not anti-vaccine. I am pro-informed consent, which means that you are informed of both the risks and the benefits for your family. I am pro my children having a right to an education unhindered in spite of their medical status. My children don't go to school when they're sick. We keep them home. We don't spread communicable diseases. How can you spread a disease you don't have? So those are my 2 cents today. I'm going to tag some accounts that are really helpful in understanding all of this stuff, and they explain it probably way better than I do. But it matters because California is setting a precedent, and they're already working on federal laws to mandate vaccinations and prevent children from going to school. So that's my 2 cents today. I am now out of the closet when it comes to this. If you have questions, feel free to DM me, but I will delete disrespectful comments. So thanks for watching. Also, I want to apparently I have a lot to say today. Talk for a second about this argument that I hear all the time, that the science is settled. I remember a time where I was sitting at the nurse's station and a parent came up and said, essentially like, I am concerned that my child regressed after the vaccine. It was a baby that came in and was having severe irretractable seizures less than 24 hours after their vaccination. I will tell you that while we are trained to deal with these emergency situations, there is nothing like seeing an infant stop breathing and be seizing so bad that they can't catch a breath. And irretractable seizures means that they do not stop. They may have like a 30-second break or a 1-minute break between seizures, but it's awful. It's awful. I would not wish it on anyone. And this parent came up and said, I'm really concerned, about this. And the nurse, it wasn't me, I was standing behind this charge nurse, said, oh, that's been debunked. Like, they found that, whoever reported that it was false information. And the look, I was shocked, like, about this. And the mom turned away and left, and I was so shocked I didn't know what to say. Like, I just was lost for words. Like, how do I even articulate what I'm feeling right now? And then all the other nurses started beginning to make fun of these families who did not believe in vaccinations or who had questions about this. And what I want to point out to you is that if this was Zofran or Reglan or any other pharmaceutical medication that a parent was like, you know, my kid was totally fine until you gave their Zofran and then they started vomiting, or then they developed rash and hives and anaphylaxis, no one would question that. They would say, oh, we need to report that and stop that medication just to be safe. And you probably should never give it again. That's the protocol for that, okay? Vaccines, however, are a completely different story, because what the physicians will say, what the nurses will say is, oh, the science is settled. But I just want to share with you that the science is rarely settled. It's rarely settled. And it is in the field of medicine, we always have to be open to the fact that our ideas and maybe even what came up in a study before can be debunked, okay, or can be proven wrong. So, for example, smoking. They did studies on smoking and said, guess what? It actually improves your lung function and it makes you feel better and it helps you to chill out and relax. And then 20 years later, they found that all these people who had been smoking a pack a day or 2 packs a day or whatever had a significantly increased risk of cancer. And then they said, you know, we need to put a Surgeon General's warning on this and pull it from the market. So that is what is called a post-marketing study, meaning that we've done our preliminary studies. They're okay, you know, could be either way. But there are certain things that we don't know the effects of them unless they've been used for a long period of time. So the issue with this is that these pharmaceutical companies have not reported a post-marketing study for 30 years. And they were actually sued for this. 30. I'm not trying to be weird, but 30 years that there have not been post-marketing studies done on the effects of vaccination. That is a problem. The science is not settled. And if they cannot uphold to the standard, because there is a standard in the medical community, if they cannot uphold to the standard that they need to be doing post-marketing studies, and if they actually looked at those post-marketing studies, maybe they would see that there's a reason for parents to be concerned. So that's what I have to say about that. Okay, the other thing that I wanted to say with this is, and I know I shared this the other day, that your doctor works for you. We learned a ton in nursing school about therapeutic communication and active listening and the art of listening and the art of understanding our patients and their concerns. And so for me, the blatant disregard in the medical community for what parents are saying, these parents who live with their children, they know their children. They know their children better than any of us do, because we don't live with them. We don't know them intimately. And, you know, we all know that we live with our kids, right? We know them better than anybody else. And so we know things about them that we cannot necessarily even articulate. So we rely on our medical professionals to trust us when we say, I don't know, I just have a feeling that something is not right. So medical professionals, nurses, doctors, PAs, nurse practitioners, whatever you are, whatever your designation is, you don't actually have the right to disregard a patient and their concerns. The fact that doctors are kicking patients out of their medical offices and their practices and saying, we're sorry, we're not going to treat you unless you're 100% vaccinated is wrong. It's not just bad practice, it's wrong. Like on a moral, ethical level that goes against everything that we align ourselves to when we signed up for nursing school or medical school. Because ultimately then you're serving yourself. You're not even serving your community. And I'm not even going to get into the bonuses that doctors receive for getting vaccines, because y'all are going to think I'm a conspiracy theorist. But nurses, doctors, listen to your parents. Listen to them. They know their children. It is not going to harm them to delay their vaccinations if that is what is in the best interest of their family. It's not going to. So, parents, remember, the doctor works for you. You don't have to listen to what they say if it is not in your best interest, and trust your gut.